Good morning, everyone. I'm a third year physiotherapy student, and today we'll be discussing one of the most important topics from medicine and even from the clinical case perspective. So, the topic is COPD. Full form of COPD is chronic obstructive pulmonary disease. Okay, first we'll start with the definition. COPD is a chronic lung disease characterized by persistent airflow limitations. Okay, which is not fully reversible and usually caused by smoking. ओके तो सीओपीडी एक लंग डिजीज है, एक क्रोनिक लंग डिजीज है जिसमें एयर फ्लो लिमिटेशन होता है, एयर फ्लो को अफेक्ट करता है. ओके, द मेन कॉज ऑफ सीओपीडी इज स्मोकिंग. ओके, as you can appreciate, this is the healthy lung and this is the affected lung. I'm sorry. Yeah, so this is the healthy lung and this is the affected lung. Okay, in healthy lung, if you can see, the bronchioles are normal, but in affected lung, the bronchioles are narrowed and blocked. See, can you appreciate? Yeah, so the bronchioles are narrowed and affected. You can draw this type of diagram even in the exams. Okay, so the causes, the etiology for COPD. First common cause is smoking, as I told you. Second is the biomass fuel exposure. And the example for this is the chulha smoke. Okay. Third is the occupational dust and chemicals, which is most common in industrial patients. Fourth cause is alpha-1 antitrypsin deficiency. So what is alpha-1 antitrypsin? What is the role of alpha-1 antitrypsin in the body? So it protects the lungs from damage caused by enzymes released during inflammation. Okay, it protects the lungs from damage caused by enzymes. What is the pathology of COPD? So, chronic inflammation of airways, as it affects the airways, it blocks the airways. Narrowing of airways, okay, as you have appreciated here, even the bronchioles are narrowed and blocked. Yeah, so the narrowing of airways, destruction of alveoli, air trapping, air is trapped as the airways is narrowed, and if the air is trapped, so reduced airflow, okay, in the body, yeah, so it leads to hypoxia and hypercapnia. What is hypoxia? Hypoxia is the oxygen decrease in oxygen level in the body, okay. And what is hypercapnia? Increase in carbon dioxide in the body. Increase in carbon dioxide level in the body. The clinical features of COPD, okay. So it is divided into two types: symptoms and signs. The symptoms: chronic cough, progressive breathlessness, sputum production, and wheezing sounds. And what are the signs? As these signs can be appreciated on observation. So first is the barrel-shaped chest, use of accessory muscles, prolonged expiration, and reduced breath sounds. These are in the very lean language. Okay. Normal alveoli and damaged alveoli, as you can appreciate here. So this is normal alveoli. Okay. And this is the damaged alveoli. Okay. Sorry. This is the normal alveoli and this is the damaged alveoli. For this investigation, so first is the spirometry, second is this chest X-ray, in which you can appreciate the hyperinflammation of the lungs, and ABG, arterial blood glands. What is ABG? So ABG is the blood test done from an artery to check oxygen level, carbon dioxide level, and blood pH level in the body. Okay. Now we'll come to the management of COPD. So management can be divided into two types, non-pharmacological and drug treatment. First is the non-pharmacological. So smoking cessation, this is the most common and most important. Pulmonary rehabilitation and vaccination, influenza or pneumococcal. Okay. Second is the drug treatment. So in drug treatment, there's the bronchodilators, anticholinergic drugs, inhaled corticosteroids in moderate to severe cases, and oxygen therapy in advanced cases. Okay, I hope you got the basic idea of what is COPD. Yeah, thank you so much.